I had to come see my grandson play his high school game. I had to see one. You know, I hadn't seen him play yet, so this was my first time, and I really enjoyed the trip. I was worried about this virus thing, but I had to see him.
During the Thanksgiving, we were highly encouraging everyone to follow the CDC guidelines, to stay at home with your immediate family and celebrate Thanksgiving that way. We certainly don't want to see any more people get COVID-19, and with the pandemic, such a national concern.
So what we expect, unfortunately, as we go for the next couple of weeks into December, that we might see a surge superimposed upon that surge that we're already in. And, you know, and when I give that message, I don't want to frighten people, except to say it is not too late at all for us to do something about this, because as we travel back, to be careful when we go back to where we are, to just continue to do the things that we've been talking about. An important issue, Chuck, is that we know when you mitigate with masks, with distance, with not having crowds or congregate settings, that those states that have done that, you could actually see that the inflection of their curve starts to do this. Right. So we know we can do something about it, particularly now as we get into the colder season and as we approach the Christmas holidays. I got a couple of calls from colleagues and associates who were very much involved in different states throughout the country saying, we're at that point where we soon, if things don't turn around quickly, we're going to have a situation with capacity, not only of hospital capacity, but staff. You know, what do you think we should do? I mean, almost pleading for advice about, you know, what can we do? We don't want to lock down completely, but we might have to if this, and I'm talking locally, I'm not talking about nationally. I'm talking about individual locations of people starting to see significant stresses on the hospital and healthcare delivery systems.